كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. We want to welcome you again to our program of health and lifestyles. And in today's series, we are going to talk briefly about screening for diseases, screening for conditions that actually can affect somebody from actually even during pregnancy, how it can affect the unborn babies, and to the children who are born once they become youth, once they become middle age, and even at the elderly stage. So these are some of the things that we can actually try to look for even before a diagnosis has been made. And this actually entails people to be more proactive than just to wait for one to become sick so that he can be checked or he can be seen what the disease is. So these at different stages, these are things that actually we can do. We can be examined even before we get sick so that we can be known whether we have potential signs or symptoms that could tell us that this is a particular disease, so that either it can be cured or it can be controlled, or it can be stopped very early at that stage before it becomes completely open, it becomes a complicated case. So these is actually things that actually we can actually look for so that we can know what are these conditions that either could occur if they are not contained, if they are not controlled, or if they are not stopped. And some of these screenings, basically it depends on the type of the screening, and the three major types of screening. We know there is what we call the mass screening, that is universal screening. In this type of screening, the whole population in a particular area is actually targeted for that screening, so that they can look for that particular condition. For example, if all the people in a certain area, they are screened for hypertension, so that can be known whether they have high blood pressure or not. There is what we call high risk or case finding screening. In this case, for example, a particular family is affected with a certain condition, for example, pneumonia, or it has been known that in this family there are people who die suddenly because of heart condition, for example, ischemic heart diseases. That is a disease of where the heart has a problem and somebody dies suddenly. So that at this moment, or this targeted population or people, they're actually being screened for a particular case that is known. Maybe it happens in the family, so there is high family risk. So they're screened to be identified if the same family members have or could potentially have the same condition. There is what we call a multiphasic screening, and in this multiphasic screening, people are screened for more than one condition. For example, all of them are screened for hypertension, but at the same time, there are those who are targeted, as the earlier we had mentioned that example of ischemic heart disease, a condition of the heart. Some of these family members having these diseases, so they are not just screened for one condition, but for two screening. The other screening that actually interventional, that they want actually to correct a particular issue or case. And we know, for example, during pregnancy, that the unborn babies could be affected by a different condition, and there are some screening things that can actually be screened from the mother's blood, or from the amniotic fluid, that is the fluid surrounding the baby. It can actually been removed, and then it can be tested for certain parameters. For example, the alpha fetoprotein. These are proteins that, if they're seen in the unborn fetus, it could show that there is a particular abnormality that is happening in that child, and appropriate management will be undertaken. Once the child is also born, some of these screenings actually don't need to be a very complicated screening mechanism or things that need highly sophisticated machines or equipment. For example, once a child is actually born, it is very important that when the child is received, either by an experienced nurse or a person who has been taught, or by the pediatrician, to check for certain things that actually could point that there is a problem. For example, could check the eyes, and in certain cases, what we call retinoblastoma, a kind of cancer that affects the retina of the eye. It could show with an area that instead of being black in the eye, it becomes very shiny. This could be a pointer to that this child is actually having a retinoblastoma, that is a certain type of cancer of the eye. It is also good for the child to be checked along the spinal cord and to check for a condition called spina bifida. This is whereby the spine has congenital malformation, has not developed completely, and in some cases along the back, the spinal cord of the child, it could either have there is a deformity in terms there is a loose, very tender area or an area that is open, and in some cases it is just some hair that are seen around that area. It could be a pointer that this child is having a problem of the spine that might need correction, might need special attention. And also in a born child, a newborn, it's also good to check for the joints, whether they are intact or not, by trying to manipulate them, to move them in the direction that they are supposed to, and also to look at the feet, whether they have abnormalities, like the club foot or the equinovarus, so that they have turned in the opposite way. So these are also physical screening examination that actually a person who is experienced or knows about them can actually check, and actually this could help to correct them, or could help the child to be managed at an early stage before these conditions become complicated or this condition worsens, and in the long run could help the child actually to gain a better life quality by this condition being corrected. As the child grows, we know there are other issues that can be also be checked. Example, how the child is growing, the growth, the development of the child in terms of, is it growing as expected? There is what we call the head circumference measurement. It can be measured. It could be a pointer to the brain growth, whether it is growing normally or not. In some cases where there is excess fluid being produced in the brain, that is the cerebrospinal fluid, and it enlarges the brain and the skull to circumferences that are not normal. It will be a pointer that there is excess fluid, cerebrospinal fluid being produced, and this, if managed at an early stage, can actually prevent the child from having a condition called hydrocephalus, that is a very big head because of the fluid. And in this condition, most of the brain substances is actually squeezed by this fluid, and it will mean that the brain development actually will not be to its potential, it will not be adequate, and the child will be affected, might have weaknesses and abnormality of different places because of this compression of the brain. So these actually also can be picked very early by knowing the circumference of the head, whether it is growing normally or not. And once it is found, it can be corrected very early. We know in children, in terms of, for example, growth, the testes needs to be checked, whether it has come down to its normal position or not. And if not, it can be done other investigation to see what is the problem, where has it stuck, and what can be done early enough because if the testes do not descend to the area where the suppose is, that is the scrotum, we know that they'll be actually spoiled. They'll get abnormality in the areas where they are not supposed to be, because they have different, they have specific temperature and condition that they are supposed to be in for them to function normally. So these are some of the things that are needed to be checked. We know during puberty, the youth are growing at a different rate and ages and different development stages. So the things that need to be checked and to be screened, so that they actually can be seen that they are growing to the normal or to the expected development magnitude. And at other times, especially when people at the middle age, we know that the simple mechanism to check for some diseases, for example, hypertension, by using a blood pressure machine, people can be measured to see what are their blood pressure. We know that people can also can go for screening for diabetes. Many people, by the time they are diagnosed or they have been known to have diabetes, it is after some complications have come and they have gone to the hospital, and once they are checked, it has been seen that they have diabetes. So this complication could vary from problems of the eye. The person now is not actually seeing properly. It could be because of the nerves being affected, especially at the extreme areas of the fingers and the toes. That is, a person now starts having needles, pins, and pain in the fingers and the extreme, because now the diabetes has become at an advanced stage, has complicated, and that's when the person went to the hospital, and it was found that once he was checked for the sugars in or her or his body, it's been known that now this person has diabetes. So some of these screenings are not necessarily complicated investigations. There are simple things that can be done, and they can actually save a lot. So it is important for some of these checks to be done in what we call medical checkups, and it would be good, advisable that at least once in a year there is somebody can do a full medical checkup, and this could help to prevent or to know which are some of these potential problems that a person could have. And a full medical checkup in terms for example, doing even the blood checkup in terms of a full hemogram, that is checking the parameters of the blood. It could actually be a pointer. For example, if there are raised white blood cells, it could be a pointer that there's an infection somewhere else. If the white blood cells are high, this is infection potentially somewhere. If the red blood cells are high, this could mean that there's a problem. Or if they're low, it could also be a problem leading to anemia. And now the cause could be looked into, and once it is known, it can be corrected. So some of these screenings are simple screening measures that can be done. We'll break, and once we come back, we'll also talk about some of the other screenings which entail investigations or major screening that especially are done at the health facilities to check for some of these conditions that actually can be managed earlier. Wa alaikum salam. Assalamu alaikum warahmatullahi wabarakatuh. Welcome back to today's series where we are talking about screening. And earlier we had talked about some of the simple screening examinations that can be done, actually that can actually see potential problems that could be there and could be managed. Currently, we'll briefly discuss some of the screenings that are what we say major investigation might be needed, so that it can actually be find out if you have these conditions or not. In terms of different cancers, for example, we know breast cancer. It will be good for our sisters, for our mothers, for our ladies to go and do mammography. That is, there's a radiograph, an X-ray that is actually taken of the breast to know if there are any abnormal growth, if there's any abnormal condition of the breast, and this could be a pointer to a person having the cancer of the breast. We know, for example, males, especially males who are above 40 years, it will be good for them to do the prostatic surface antigen, that is the PSA, and this actually is a good pointer to most probably this person could be having prostatic cancer. So it is good for males above 40 years for them to do annually the PSA, for them just to have an indicator whether somebody could be developing cancer of the prostate or not. It's also good for all of us to do what we call a colonoscopy. This is an investigation where it checks the large intestines, that is the colon, if it could be actually having or any signs and symptoms that could lead to a colon cancer. And once it is seen at the early stage, it will be managed better, it can be treated. So it will be good for people to do this test. It is also good for especially mothers who are in reproductive age to check for cervical cancer, so that they can be checked for the human papilloma virus, the HPV, so that if it is seen, it can be contained, and if it's in early stages, it can be managed appropriately, but not to wait until it is too late, it is too complicated when it is, for example, stage 3 or stage 4. So it is good for them to check for cervical cancer, especially those who are engaged, they are sexually active, they are in reproductive age. It is good for them to do at least yearly to see if there is any signs and symptoms for the cervical cancer, and to prevent it early. Also, in terms of other cancers, for example, skin cancers, it will be good for any abnormal changes or changes that are seen on the skin that are not the normal, for them to be checked. It could be cancer of the skin, for example, a dark spot that has occurred which initially was not there. It is important that it could be checked. It could be a potential skin cancer. Wound or injury that actually normally should heal, for example, in 2 weeks' time, but it's taking too long, for example, 3-4 months, and it's not healing. It is important that it is checked, so that if it is a potential cancerous problem, it could be managed early. So other conditions that actually can be screened, for example, in the area of mental health, we could do what we call the back screening inventory, or the special anxiety screening for people. This could be a pointer to a person having a depression or anxiety, respectively. And these, once they are managed early, it is better than to wait when it is too late. A person can also be screened for some of the communicable diseases. For example, tuberculosis. A person could be screened so that the person could be known whether he is developing tuberculosis or not, or it is within the person, but it has not come out, it is not known, so that the person can actually be treated, managed for the same. People can also be screened for cancers at different regions. For example, people with diabetes mellitus can also be screened whether they are developing a complication of the eye, so that it can be managed early, it can be stopped, One, by them taking their medication appropriately, but if it is at a stage that it has been affected, we know currently there are laser management of some of the abnormal blood vessels that have been affected in the eye, in the retina, that can actually be managed. So it would be good for them to be screened for this. In other cases, people can, during their routine or annual medical checkups, they can have the blood screen for different types of abnormal cancerous pointers that can be seen, so that they can actually be managed early. Some of the other diseases also that we might screen for is metabolic disorders. These are disorders that are actually found in the metabolism of different aspects of the body. Some of these are the galactosemia, that is the breakdown of sugars in the body. It is abnormally broken down. We have other metabolic disorders like the Haller syndrome, whereby there is a developmental delay, there is problems in the bones, and the children could be affected. So these are some of the conditions that also could be identified by screening, especially in the children early enough, so that they can be corrected or they can be managed better. Some other conditions in the children, for example, low hearing could be detected in the newborn. So it will be important for them to be checked, to be screened for these conditions. So once they are screened, this helps in a better management, in early management and correction of these conditions once they're found early, so that they do not progress and become complicated. They do not lead into a stage that they have become a complication, and at this stage usually it's very difficult to manage them and has affected the person negatively and might not be corrected. So these are some of the conditions that at different stages that need to be checked. There are also checks or screening that could be done for problems in the lungs, to see if they have any problem like cancer. The other organs like the liver, in different conditions, they could be screened so that you can see if the liver is functioning well. This is done by doing the liver function test, and there could be a pointer to either the abnormality in the what is happening in the liver, or it could be a pointer that there is a negative condition like cancer that is going to occur in the liver. Then sometimes we could use radiograph, that is things like ultrasound, to check some parts of the blood vessels to see if they have any problem. For example, the abdominal aortic aneurysm. This is the weakening of the blood vessel called the abdominal aorta in the blood system. It becomes a bit weak, then it forms like a soft spot, and there is a ballooning of the blood vessel at that particular area, and these could potentially rupture and become cause death to the person. Things like MRI could be check aneurysm that are occurring in the brain, so that if there are these weak areas in the blood vessels, that could be potentially dangerous, because they can rupture, they can burst, they can actually be contained early, or they can be managed. So using a different radiological investigation actually could help in terms of screening for some of these blood vessel problems, and they could be managed early. So it is very important for people to have a high index of suspicion. It is very important for people to have a positive behaviors, so that they actually go for checkups, they go for screening even before they are sick. So people should not just wait until they're sick for them to go to the health facilities. There are many conditions that actually could be prevented early by early screening and by examination. So with this, we want to thank all of you for being with us and watching this episode of Health and Lifestyle. Assalamu alaikum wa rahmatullahi wa barakatuh.
كن سعيدا كن فريدا عش بفخر في الحياة، لا تبالي فالمعالي بالتحدي لا سواه. كن سعيدا كن فريدا عش بفخر في الحياة، لا تبالي